Hello, my name is Robert Brill. I'm a doctoral candidate in health psychology, and this is my Fibromyalgia podcast series. Today I'm going to discuss the American College of Rheumatology's 2010 diagnostic criteria for fibromyalgia. Are you aware that in 2010, the American College of Rheumatology established new criteria for diagnosing fibromyalgia? This criterion does not replace the unfortunate criteria established specifically for research in 1990, but instead it is to be used as an alternative method of diagnosis that is more suitable for use in the clinic versus the research lab. If you have fibro, you need to learn the new criteria and prepare for your next doctor visit with a new perspective. Keep in mind this criteria is based on patient data, and the American College of Rheumatology finds the criteria to be clinically meaningful. The criteria is as follows. A patient satisfies diagnostic criteria for fibromyalgia if the following three conditions are met. Number 1, the widespread pain index of 7 and a symptom severity scale score of 5, or a widespread pain index of between 3 and 6 and a symptom severity scale score of 9. Number 2, symptoms have been present at a similar level for at least 3 months. Number 3, the patient does not have a disorder that would otherwise explain the pain. So for the widespread pain index, the clinician will note a number of areas where the patient has had pain over the last week. The score will be between 0 and 19. For the symptom severity scale score, for each of these three symptoms, fatigue, waking unrefreshed, and cognitive symptoms, the clinician will indicate the level of severity over the past week using the following scale. He will rate you with a 0 for no problem, a 1 for slight or mild problems, generally mild or intermittent, a 2 for moderate, considerable problems, often present at a moderate level, or 3, severe, pervasive, continuous, life-disturbing problems. The clinician is going to consider somatic symptoms in general and indicate whether the patient has the following. No symptoms, they would get a 0. Few symptoms, they would get a 1. A moderate number of symptoms, you'd get a 2. And a great deal of symptoms, you would score a 3. The symptom severity scale is the sum of the severity of those three symptoms, again, fatigue, waking unrefreshed, and cognitive symptoms, in addition to the extent or severity of somatic symptoms in general. The final score will fall between 0 and 12. The clinician will also attempt to rule out other conditions like arthritis through a palpation exam or lab or imaging results. Thank you.